Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today we are going to take a deep dive about all the things that happened for me at American Laser Study Club's Breathe and Thrive conference this weekend. Let me tell you, it was eye-opening and enriching. I just got back and I'm very excited. As many of you know, I'm passionate about helping professionals understand tongue tie, especially in relation to breastfeeding and infant health. But this conference really expanded my perspective, and it reinforced that tongue tie isn't just about newborns, it's about lifelong health, airway function, and quality of life. So today I'm going to share 5 major takeaways that stood out for me. These are insights that I believe can help anyone working with infants, children, or even adults dealing with oral restrictions. Whether you're a lactation consultant, speech therapist, chiropractor, body worker, dentist, doctor, or any other healthcare professional, this information is for you. So let's dive in. Number 1, tongue tie is more than just a breastfeeding issue. And, one of my most popular posts actually over the years says this is more than just about breastfeeding. But for years, we've looked at tongue tie primarily through the lens of breastfeeding. We focus on the immediate challenges, poor latch, nipple pain, low milk supply, weight gain issues, and so on. You all know those, right? While those are critical concerns, tongue tie doesn't stop being a problem once a baby moves on from breastfeeding. We are seeing more and more evidence that oral restrictions can have lifelong consequences on oral development, breathing and airway health, speech and feeding issues. So for oral development, a restricted tongue can affect how the palate forms, leading to a high, narrow palate and crowding of teeth. And I speak from experience from someone who has a high, narrow palate and is just finishing my Invisalign treatment. And I did have a tongue tie. So it all goes together, and I see it in children, and we saw lots of evidence talking about that this weekend. The second thing I mentioned that's more than just breastfeeding is breathing and airway health. And a tongue that isn't functioning properly often leads to mouth breathing and sleep-disordered breathing and even sleep apnea later in life. And I've even seen some newborns that are already mouth breathing and having problems regulating that suck, swallow, breathe pattern that's important in newborns and is part of normal development. And then there's speech and feeding issues, which come beyond breastfeeding, which is that many children with undiagnosed tongue ties struggle with speech articulation, difficulty chewing, and even swallowing. So one of the things that I want to say about that is we heard from a couple of people about how there is a controversy. I hate the word controversy, but there's a lot of controversy in this field of speech language pathology, whereas not all speech language pathologists believe that tongue tie matters. Crazy, right? And I don't understand the idea that anyone who thinks that the way the tongue moves doesn't affect how we speak, because we use our tongue to speak. So little common sense here, guys, but that's one of the things that was discussed this weekend. So while breastfeeding may be the first problem we notice, it's just the tip of the iceberg. As professionals, we need to think beyond infancy and consider how tongue tie affects a person's long-term health and function. That being said, if there's no problems in infancy, we never, ever, ever want to do a procedure on a newborn to prevent future problems. If everything is working at the level of an infant, we don't want to say, oh, everything's fine, but we're gonna release it anyway. So if anybody has that idea and wants to discuss it, I'm open to it. Never release something, never do something to prevent future problems, unless there's a problem now. So we want to go with function, right? Okay, get off my future-based soapbox and go on to the second thing that I learned. The second major takeaway from this weekend is collaboration is key. No one can do this alone. I really was thrilled at how many teams presented this past weekend at the conference. How many people are finally getting together and practicing together or practicing in a geographic location where they can refer to each other and network and collaborate to help out the patient in question. So what is it about collaboration? Who's on this team? As I like to talk about the tongue tie team. Lactation consultants are often the first to identify a tongue restriction in infants. Speech language pathologists and oral facial myofunctional therapists help with oral function before and after a release. Typically, the speech language pathologist throughout the lifespan, the myofunctional therapist over the age of 4 or 5, depending on who you ask. That's another controversy. We need pediatric dentists or ENTs or other specialists that perform the actual release. We need manual therapists, chiropractors, craniosacral therapists, occupational therapists, physical therapists, all of these types of therapists. What else? Osteopaths. If I'm leaving someone out, forgive me. But we need body work to release tension and improve mobility at every age of the spectrum. So no single professional can fully treat tongue tie alone or tongue-tied babies. We need everyone working together on a team. One of the biggest frustrations that you may hear, and I hear it all the time, is parents getting conflicting advice. They see a lactation consultant who suspects a tongue tie, but their pediatrician dismisses it, or they go straight to a dentist for a release, but don't get proper follow-up care. I talk about this so deeply in my Professional's Guide to Tongue Tie, about how we have to all work together. And this conference reinforced how important it is to work together and communicate across disciplines so that families don't feel lost in the system, which often happens. And as I say all the time, one of our greatest jobs as professionals is to educate and empower the patients that we are working with so that they can make fully informed decisions and realize that their instinct matters and that they are in charge of their own baby, not the doctor, not the lactation consultant. They are in charge. With numerous breast pump brands on the market, one that stands out is Annabella. As an innovative company, Annabella has completely reimagined breast pump technology, moving beyond the traditional vacuum-based suction method that has remained unchanged for decades. Instead, their design mimics the natural movement of a baby's tongue, creating a more comfortable, effective, and natural-feeling experience. Unlike conventional pumps that rely on forceful suction, Annabella's approach eliminates the discomfort often associated with pumping. The result? A gentler, more intuitive experience and significantly improved milk expression. Clinical studies have shown that Annabella users produce an average 50% more milk compared to traditional pumps. With superior comfort, advanced engineering, and proven efficiency, Annabella represents a true breakthrough in breast pump technology. Discover more at annabellapump.com and use code TTE15 for Tongue Tie Experts to receive 15% off your purchase. Takeaways for professionals is that we need to build a network of trusted providers. If you don't already have strong referrals for tongue tie releases, bodywork, or therapy, now is the time to start making those connections. And I have other episodes on how to do that, how I have done that. One of the ways that you can start to do that literally today is the Tongue Tie Experts group, which is a professional membership where we make connections for each other. So you can find those links in the show notes. Okay, so I'm getting a little wordy, but I love talking about these things. So I'm going to keep going on the 5 takeaways I have for you from the Breathe and Thrive conference this weekend. Number 3 is function over form. Releases aren't just about cutting tissue. One of the most misunderstood aspects of tongue tie treatment is that we have to realize the goal isn't just the release. It's proper function of the tongue and oral muscles. What that means is assessing function before the release, providing pre-release exercises, focusing on aftercare and therapy. So if the baby or child or adult can't move their tongue properly before the procedure, it won't magically happen afterwards. We need to see where the function is to know if we even need this procedure, right? We can't just rush to procedure. We want to make sure that it's affecting function because it's not just what it looks like, it's what it can do. So in a baby, the function is breastfeeding. In an older child, it is breastfeeding and eating, or drinking from a cup, or speaking, depending on the age. And for an adult, it could be sleep, feeding, speech. For a child, it could also be sleep too, right? Which we heard a lot about. The pre-release exercises, we want to talk about strengthening the tongue and surrounding muscles before the procedure, because those of us who do this full time feel that it leads to better outcomes based on what we are seeing. And there's research going on about this. And then we want to focus on aftercare and therapy. The release itself is just the beginning. Without proper aftercare, the wound can heal too tightly, or the tongue may not strengthen to learn to move freely. I heard from so many experts at the conference who emphasized the importance of myofunctional therapy for older children, oral motor for babies, lactation support, and body work, ensuring a successful release. If we only focus on the procedure itself and ignore function, we risk reattachment, limited improvement, and most of all, frustrated families who don't see the results they were expecting, which trickles down to criticism of our work. We want to be really careful to do this right because as tongue-tied professionals, we are under the microscope. I heard from a dentist who was called in front of the board in their state to review a patient chart when they didn't even do the procedure. They just talked about it. So we want to be really, really careful about this. Takeaway for professionals: don't rush to recommend a release without considering the full picture of tongue function and therapy needs. There was even some research about the proper timing of release and how much therapy for how long before and after in infants and breastfeeding, which I'm going to have that exciting team on soon to talk about how their research is going and what they told us at the conference. We had so many really cool talks. Okay, so we're up to the fourth takeaway from Breathe and Thrive. And this is perhaps the most exciting for me because I'm involved in a project called the Airway Revolution Foundation, which is a nonprofit, which soon we'll have our documentary released all about airway and how it relates to health. And you can go to airwayrevolution.org. It's a nonprofit. They're looking for stories of people that are suffering with airway issues. So back to airway health starts early. Why infant breathing matters. And it does matter. And as I said before, I sometimes see newborns that are already having trouble breathing. There was a big focus at the conference on airway health and an increasing focus on airway health and how it connects to oral function. Breathing isn't something we always think about in the newborn stage, but the way a baby breathes, sucks, and swallows from day one has lifelong effects. We even had demonstration of how what it means to have a baby's nose completely blocked and how we know if there's something wrong with the nasal structure that we have to open up. That has nothing to do with the tongue tie, but we need to know that that baby can breathe through its nose. Babies are designed to be nasal breathers, but tongue tie and oral dysfunction can lead to mouth breathing. Chronic mouth breathing can cause poor oxygenation, increased risk of sleep apnea, and changes in facial structure and jaw development. The connection to sleep apnea is real. Many adults diagnosed with sleep apnea had undiagnosed oral restrictions as children. Early intervention could prevent these airways later in life. But again, if they had no problems, we should have corrected it early. But you want to go back in the history and say, were you able to breastfeed? Did you have these symptoms? Did your parents have these symptoms? And a lot of times along the way, you'll hear the story of oral restriction from a newborn on, but it wasn't recognized that those symptoms were connected to oral restrictions. For example, I was a baby that, well, my mother never tried to breastfeed because it wasn't in vogue at that time, which is really sad for me. But even on a bottle, I had constant reflux. She tells stories of how far I would be able to reach with my reflux, which is kind of sad, and kind of gross, but it's the truth. She also told me stories of how I had a flat head as a baby, and the doctor recommended exercises back then to correct my flat head. I grew up always with migraines. I always had posture issues. I had stomach distress from an early age. I needed to have orthodontia, but they waited very late. They had to take out a lot of teeth. I remember being told by a dentist that I had a bubble palate, but don't worry, there was nothing to do about it. So there were signs along the way of my oral restriction, but nobody picked it up. Okay, so the importance of breastfeeding is real because breastfeeding itself plays a role in airway and jaw development because it promotes proper tongue and jaw motion. So the takeaway for professionals about airway health starting early is that we need to not only assess the baby's latch, but also how they are breathing and whether there are signs of airway dysfunction. And airway dysfunction beyond the tongue. We want to think about the nose too. Make sure the nose is patent so the air can get through. The fifth takeaway is there's still a lot of misinformation, maybe even controversy, and disagreement in the profession. Even at this high-level educational experience, there were people whose presentations contradicted each other. So this is hard, right? So if professionals are still having these problems, imagine what it feels like to parents. We want to be really careful that we're only sharing evidence-based information, and we want to think about how we practice and make sure that we are sure whether the experience and the research or the evidence is our own practice and experience or studies that are out. We want to be really careful. So some professionals still believe that tongue tie is only a problem if the baby can't stick their tongue out. I didn't hear this weekend, but I do hear it a lot, that function matters more than appearance. I heard professionals saying that they hear other doctors say babies will grow out of feeding issues, and many don't. And problems often resurface in speech, eating, and airway development because babies are very good at compensating, right? And then I also heard that there are still some people who preach, for lack of a better word, that only severe cases need treatment and are rating the oral restriction on a scale and thinking that only certain scales need help. And in reality, even mild restrictions can cause significant problems. It's all about the function, not about what it looks like. So one of the biggest benefits of attending this conference was learning from experts who are at the forefront of the research. We must continue educating ourselves and challenging outdated information. My biggest takeaway for professionals is keep learning, keep questioning, and most importantly, advocate for your patients and families when they're not getting the support they need. The conference left me feeling inspired and even more committed to helping professionals like you understand tongue tie in a deeper way. I hope this breakdown gave you valuable insights that you can take into your own practice. Which of these points stood out to you the most? Have you seen these challenges in your own work? Let's continue the conversation. You can email me or come over to social media and reach out. If you are looking for more educational opportunities, I go deeply into each of these 5 aspects of tongue tie education and tongue tie knowledge in the Professional's Guide to Tongue Tie and the Parent's Guide to Tongue Tie, which is about to be reissued, updated, and relaunched as the new Parent's Guide to Tongue Tie. So reach out. I'm here for you. Thank you so much for being here. Hope everybody gets to enjoy a conference like this one. There's another one next year. There's ICAP in 2026. They're having a mini conference in Europe in June. There's lots of educational opportunities. And of course, becoming a part of a group like Tongue Tie Experts Insiders. Thank you for being here. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.